Welcome to Appointed.
Well, welcome. It is wonderful to be joined today on this edition of our podcast, Appointed, by the highly regarded, incredible colleague, incredible leader, mentor, social worker, educator, researcher, activist, advocate, uh, the Honourable Dr. Senator Wanda Thomas Bernard. And I love the quote that you often use, and I want to start there because it's partly why I wanted to make sure we talk to you about this issue, because you talk about being the change that that anybody who sees issues shouldn't just sit back and wait for things to happen. I'm not doing an adequate, I'm paraphrasing, but that you should lead the change you want to see in the world. And I love that about you. You definitely have done that. You were the first in so many things, the first tenured and full-time professor, African Nova Scotian professor at Dalhousie University. You were the founder and continue to be an incredible member of the Association of Black Social Workers. You continue to teach, you continue to lead, you continue to mentor, and I would say instigate and be an accomplice. Some would say ally, but I like accomplice to so many who are providing leadership in so many areas. And I want to thank you. You have honorary doctorates up the yin yang. Sorry, I don't mean to be in any way disrespectful. You have many honorary doctorates, many other awards, and you are also a member of the Order of Nova Scotia and the Order of Canada. And really are what else can I say? An incredible leader, and I consider you an incredible mentor and friend, and someone who I really look up to in terms of the work you do. And even though I think I might be a little bit taller than you, but I still look up to you. So I want to thank you very much for joining us, Senator Bernard. As you know, we're discussing the whole issue of, in this podcast, we want to discuss, amongst other things, but the work that Member of Parliament Leah Gazan, First Nations Member of Parliament Leah Gazan, and I've been doing on trying to have a framework document, a framework piece of legislation passed that would require the government to look at, among other things, national standards for social, economic, and healthcare, but in particular, the need for a framework for a guaranteed livable income, and that would involve consultation with provincial, federal, municipal governments, as well as other governance bodies. And I'd love to know your opinion on how you would see a guaranteed livable income might impact, in particular, the areas of poverty, healthcare, and the legal system when it comes to Canadians of African descent.
So let me start by saying thank you very much, Senator Pate, for inviting me to be part of this. But more than that, thank you for your incredible leadership and advocacy on this. It's so important. It's just so very important that we do this work. And I thank you for being an ally and a friend. And we met. We were appointed at the same time, and it's been a pleasure to work with you for these past 8 years. So thank you for bringing forward this legislation, and I value the opportunity to speak to it, because when I think about a guaranteed livable income, I can't help but think about African Nova Scotians, African Canadians, people living on the margins of society. And one of the things that holds us back, that keeps us sort of trapped, is poverty. And when you're struggling just to make ends meet, when you're struggling to know, whether you pay for medication or pay the rent so you have a roof over your head, when you're struggling to figure out, what to buy in the supermarket, or even if you can get to the supermarket, when you're lining up at a food bank, it's hard to do other things in life when you're figuring out, you're trying to find a way just to hold it together for your family. And for women in particular, I think for mothers, for grandmothers, this has been, particularly harmful. This is particularly harmful. It's hard to learn when you're hungry. It's hard to study when you're hungry. It's hard to work when you're hungry. It's hard to parent when you're hungry. And poverty impacts everything else in our lives. When I think about the social determinants of health, and the poverty, is the glue that keeps all of the other oppressions intact. Poverty is really the glue that really keeps us from reaching our full potential. So a guaranteed livable income would make an incredible difference in the lives of people who are struggling every day, the everydayness of poverty. It's really hard.
Mm-hmm.
I can't talk about this without thinking about my own family. And I would say that my own family journey is really what fuels my passion, which keeps me doing this work, which keeps me leading the change I want to see. Because when I look back, our mother was widowed at the age of 39 with 12 children she was responsible for. The youngest was only 18 months old. The oldest child at home was 18 years old. I was 12. My sister next to me was 14. And, in the gendered lives we grew up in, we were the two that really stepped in and helped Mom. And our mother had to go to work full time. But she had no education because with the segregated school, it only went to grade 8. And because she was a female, her father wouldn't send her to the city because he had to pay, and he refused to pay because of her gender. And then, 10 kids later and 2 grandchildren, she's a widow. And the only job she could get was that of a housekeeper. She worked in service. But she received income assistance. And back in those days, and they knew she worked, and then she got a job at cleaning at a hotel, and it was minimum wage. And I remember her boss saying to a social worker, I can't afford to pay her anymore, but she can't afford to feed her family on this. So Mom worked, but she also had that basic income from income assistance. And that basic income would be what we're talking about today, that guaranteed livable income. That basic income meant that she could provide for her family with her dignity intact. And she did, I think she did a pretty good job.
I think she did an excellent job. Yeah.
And when I think about the decisions that were made, to help our family, every family deserves to be supported when they need support. Every family deserves the opportunity to reach their full potential. And our family received supports because we were seen as deserving poor because Mom was a widow. We were seen as the deserving poor. And that, just knowing that makes me really angry. It doesn't justify it at all. But it also makes me want to fight, for everyone to have the basic rights, basic human rights. I see a guaranteed livable income as a basic human right, quite frankly. Income assistance rates are an embarrassment in the country. Nova Scotia, consistently gets a pretty failing grade. That's my home province. We're not doing what we should be doing.
Hmm. Well, and in fact, I just was reading, I'm just reaching for it here, a report that one of our colleagues did, one of your, that Poverty in Nova Scotia at a Glance. Senator Kuzner had his office look at this. Oh, yes, we're both just read it, and and he talks about the very issue, and you talk about it. And in fact, the last time. Last week, I was speaking to a group of social workers at McGill, a class of social workers, and social workers don't go to school. I don't need to tell you, don't go to school to become the judges of people's morality or income and determining. And yet that's where a lot of the jobs are now in social
Hmm.
services. And so, and when you hearken back to the experience your mother had, fortunately, it sounds like she had a worker, an employer, like the intervening, the intersections of the supports that were provided, no doubt she absolutely deserved it. But this notion of who is deserving and who is not is
Yes,
such a
yes,
moral judgment.
it is.
And now that kind of discretion often is removed from social workers. They have algorithms. They punch in numbers into computers, and as I know from folks in my family and my circle who have been cut off of assistance because they've worked too many hours, or they risk being losing their medical benefits or their dental or their pharmacare benefits if they work too much, even if they just volunteer. I mean,
Hmm.
imagine telling people you're volunteering too much.
Mm.
And yet, we've set up a system that actually keeps people stuck in poverty, as
Yes.
opposed to allowing them to rebound out, which is really why I suspect I know why me, and certainly Leah and so many others have been supportive. In fact, just recently, the NDP advised that they plan to make this part of their party platform for the next election, which I think is great. I think
Hmm.
every party should have this on their party platform. And I know that one of the things that we've talked about in the past and that Leah talks about is the fact that, well, she says that the most effective way to eradicate poverty, support healthcare and justice systems as and our best chance at eliminating gender-based violence is to ensure people have the income they need to be able to take other opportunities. And as well, Dr. Jiaying Zhao, who's a researcher at UBC, has been working on looking at what you started out talking about, which is what happens when you are living in poverty to your actual ability, not just to do things, but to think. And she's done a fair bit of research on the how it limits your cognitive capacity if you go with whether it's IQ measures or people's ability to think and plan. It actually there's abundant evidence now that it completely impairs your ability. And so when we've been presenting that material to people, almost inevitably after each presentation, people come up afterwards and said, I wouldn't have believed that, except this happened to me. And then they'll describe a situation where they were suddenly homeless or out of a job, and even though they had a university education in some cases, they could not think to plan the
Hmm.
processes. All they could think about was the immediacy of how would they eat, where would they sleep, if it was in a cold, or up north in particular, how would they get enough gas to keep their car going to keep them warm? And so those are such important pieces. And you and I are also on the Human Rights Committee, where we're right now talking about, thanks to you, looking at a study of young people leaving care. And we know that's an area where young people often get literally dumped out of the child welfare. It seems odd to call it that, the child welfare system, and left to really try and survive on their own. We've talked about in previous podcasts around Black Lives Matter and the impact, the pipeline almost to prison of the child welfare system of poverty. And I wonder if you want to explore that a bit more. I notice you've got your Black Lives Matter earrings on today, and so it strikes me as we definitely have to explore how does this in particular impact and how would a guaranteed livable income help alleviate some of the issues like the mass incarceration and the criminalization of racialized folks, particularly those of African descent?
Yeah, so we see the school to prison pipeline and the child welfare to prison pipeline. And I believe that a guaranteed livable income would certainly disrupt that. And that's what we need to do. We need to disrupt those pipelines. So we have these, it's that intersection of racism, anti-Black racism, and poverty. And even if you're not living in poverty and you happen to be Black, you're dealing with that anti-Black racism. And the impact of that, like the everydayness of the racism has it's a trauma. And I think there's been a lot more research done on trauma, but not necessarily on the trauma of racism. And I think we should also be looking at the trauma of poverty and living in poverty. So if you think about trauma and the impact of trauma, and especially for young people who are leaving high school, some young people that I've talked to over the years are afraid to leave high school because they're afraid to transition into adulthood because of what that means. And they feel so ill prepared. And in the child welfare system, their graduation is you're on your own. Who's ready to be on their own at 18? Especially if our systems haven't prepared them. And so we have these, what I call the compounding factors that really have such a negative impact on one's ability just to be in the world, to think through, to manage life, to manage the everyday crises that people experience in their lives. When I think about the Black Lives Matter movement that became very visible during COVID, and I think about poverty, and I think about a guaranteed livable basic income, and I think about CERB and how quickly, government acted with CERB. And for me, that should have been a stepping stone to a guaranteed livable income. But one of the things that I have found consistently since then, first of all, I would say the Black Lives Matter movement, I'd hoped that it would be a movement, but unfortunately, I think it's been a moment, not a movement. So it's a moment in time. And I think we have this missed opportunity. And the same with the work on eradicating poverty. People talk about child poverty. I totally dismiss that. There's no such thing as child poverty. Children don't live in poverty. Their parents do.
Exactly.
Right? So I've always had a problem with the naming this child poverty. I feel like I'm going in a bit of a circle with that. But what do I want to say here? I believe it was a missed opportunity to not move forward with a guaranteed livable income. And I think part of the reason why there wasn't a political will to do that is because of the stigma, the discrimination, the disdain that people have for people, that most of our society has for people who live in poverty. The blaming, the victim blaming. People don't understand this, the multi-generational cycle of poverty and how difficult it is to break through that. And it's that stigma and the discrimination and the racism intertwined with that leads us to where we are, fighting to have these bills move forward because there's such resistance. And the resistance comes from the people, who are more likely to vote.
Yeah.
There's no political will to do this, quite frankly.
No. And, you mentioned the last time when it was 2021 when we talked about Black Lives Matter, and are we, I worry from where I sit, and I don't live it, that we're not any closer to ending anti-Black racism either, despite a Black justice strategy, despite lots of words where we've yet to see the action. And I think this is true both in terms of anti-Indigenous racism and especially anti-Black racism as well. So I don't know if you want to add anything to what you've already said, but it strikes me is that we need to demand the action. That just saying that the bodies that are elected will do the right thing when in fact they repeatedly are doing maybe incremental steps, but leaving behind still millions and millions of people in this country is just not acceptable. And not just leaving them behind, but leaving them to be subject to the only system that can't refuse them, and that's our criminal legal system.
Yes, that's right. So when I think about the Black Lives Matter, and I think about government and what we have, I mean, so we have some baby steps. I want to recognize that we have dedicated budget, for example, with Black mental health, resources going into Black mental health, resources going into Black community organizations, resources going into Black communities to focus specifically on housing. But when we do that and we don't take a holistic approach to what's going on, we miss the mark. So we have resources going into Black mental health, but then we have government fighting the Black class action lawsuit. They're trying to certify the class action because of the discrimination in employment. We know from research that racism and discrimination in employment contributes to mental health. So it's like on the one hand, we're saying, we recognize that there are some problems with mental health issues and the lack of culturally responsive mental health services for Black Canadians. So we know that's a problem. We're going to give you some money to fix that. But maybe the root of the problem in employment, we're going to ignore that, or maybe we're going to even resist that's a problem. And then these are federal government employees. And I believe you were part of the Human Rights Committee when we did the study that looked at anti-Black racism, systemic discrimination in the Canadian Human Rights Commission. So if they're experiencing anti-Black racism as a federal government employee, you can't even take your case to the Canadian Human Rights Commission and expect that it will be handled in a culturally responsive way. But we're going to give you money for mental health.
Yeah, when you say it that way, it seems so clear the lack of logic in terms of, the fact that you will actually make things worse and then try and do some little, as you said, baby steps towards remedying those situations instead of just preventing them in the first place, which is so often. I think of the First Nations Child and Family Caring Society claim, the inadequate delivery of services for Indigenous youth is another example. Instead of just remedying that situation, it required decades of fighting in the courts, at the Human Rights Commission and in the courts, to actually get some kind of remedial action. And even then, it still wasn't enough. We just had the Assembly of First Nations vote to say no. It's still not. You want us to agree to inequality, and we have to push further. So. I remain hopeful. I know you do too, and we continue to work in these areas. What are some things that you're seeing on the ground that you think we could be supporting and amplifying? Because I know you're doing all kinds of incredible work still in your own community, and there are incredible folks doing work around income support, social supports, health supports in the African Nova Scotian community. And are there any initiatives you want to highlight or just amplify so that folks can go look for them, and we can provide links in the notes for this podcast as well for any of those areas that we think people should look at?
So yes, like you, I try to find, where are the spaces where you find some hope and critical hope. And one of the places I would say, so with WAGE, Women and Gender Canada, I think that the emphasis on community-based initiatives on prevention, I think that's really helpful. I think that's been a really good strategy. And what I'm seeing in Nova Scotia, the Nova Scotia Advisory Council on the Status of Women, they are really trying to do that, and they're working at the intersections of gender and gender identity with various communities, and really trying to work within those communities and giving those communities the resources they need to do the prevention work in their communities. So it may look different in a Mi'kmaq community than it may look in an Acadian community, then it may look in a community of elders who are part of the queer community. The experiences may be very different. And one of the things that I'm seeing that gives me a lot of hope is a recognition that communities can define for themselves how best to do that work. And as an organization, as a government body, the advisory council is saying, it's listening, they're listening. They're listening to community voices. And I see some incredible initiatives happening across the province that are supported by the advisory council, which is supported by WAGE.
That's fantastic. So we'll put some links in to those. We'll also link Senator Kuzner's report and
yes,
and then
yes.
Any other resources that you think we should add in there, and go, anything else that you would like to add on this episode of Appointed before we.
No, I don't think so. I think that's really helpful. Thank you so much.
Thank you, and thank you again for being a guest and for all the incredible contributions you make, not just in the Senate, but in the Senate especially, and throughout the country and the community. It's really, you are a national treasure, and we are so fortunate. And I'm so grateful to have the opportunity to work with you.
You're very kind. And I think we can be part of a mutual admiration society.
Well, I think you're one step up, but I'll aspire to live up to that. That's good.
Thanks.
Thank you so much, and take good care, and we'll see you shortly at committee.
Yes. Okay. Bye-bye.